Hello, and welcome to Talk to Downtown. My name is Courtney Wood. I'm the Economic Development Director for the Downtown Stockton Alliance, which is the 501c6 nonprofit property-based business improvement district serving downtown Stockton. This webinar series is intended to connect our business owners, property owners, and visitors with the organizations, people, and resources who can help them address issues of top concern to them. Today, we have a special guest, Dr. Maggie Park from the San Joaquin Public Health Services. She's here to talk to us about, thank you, Maggie, about COVID-19 in our community. And so the way that this webinar will work, it will begin with me having Dr. Park go ahead and introduce herself and tell us a little bit about what she does over there at the county. And then I will ask her a list of questions that I've outlined for her. And after that, we will go ahead and open it up to the viewers to go ahead and ask your questions. And so with that, thank you so much, Dr. Park, again, for being our guest today. I'm really excited to hear what you have to say, and I'm sure that everyone else is interested too. So can you tell us a little bit about what you do at the county?
Great. Thank you, Courtney, so much for having me. Well, what I do at the county is I serve as the health officer at San Joaquin County Public Health Services. So that's my job, is to be the public health officer.
Excellent, excellent. All right, and so with that, I would like to go ahead and start with my questions. Are you ready?
Sure.
Perfect. So I'm curious, what has addressing the COVID-19 pandemic been like for the San Joaquin Public Health Department?
Well, it's kept us very busy, that's for sure. Before COVID came, we were already a very busy department with departments in tuberculosis and syphilis, which are at high rates here in our county, but we have a lot of other departments as well working on chronic medical conditions, as well as the health and welfare of children, all the way up to adulthood and seniors. So when COVID came, we just got even busier, and it's been kind of a whirlwind.
And how has the strategy of the Public Health Service Department changed and evolved since the beginning of the pandemic back in March?
Right, boy, I can remember back in even back to December, January, when we were having our very first discussions with the state and with the CDC about COVID-19, and when we started having some cases trickle in, how different it was back then when it was just me and maybe one other person here at Public Health who would go and go through a medical history with the doctor on the phone and decide whether that person could get a test with the CDC or not. So things have changed a lot. Now we're testing ferociously as much as we can. And through all of that, everyone else here at Public Health has really evolved. We've had to reorganize and restructure within public health so that people who might have been in children's medical services before have been pulled to work on the COVID team and are now full-time working on COVID cases in schools. So it's just we've had people who work on our STD branch who are now doing contact disease investigation full-time. So there's just a lot of people putting effort into this. And of course, as you take someone away from one department and put them on a COVID team, it makes all of their teammates work harder too in the jobs that they were originally doing. So everyone's been affected by this, and everyone's working very hard. We have a lot going on all the time. There's constant change. And I would say, though, that the sense is here is that we all have some purpose to our work, as busy as we are and as tired as we are. But a lot of reorganization, and we constantly reorganize. We're constantly meeting and talking about COVID. So it's not dying down, that's for sure, right now.
Okay. And so with a lot of modifications, are there any specific programs or services that you've been involved in developing as a result of the COVID-19 pandemic?
Well, internally here to Public Health, I'm just so proud of all the things we've developed. From the very beginning, we had to put out isolation and quarantine orders and speak to people, get our contact tracers together. So definitely a lot of internal change that I'm proud of. And that's all ongoing. And, another example I'd like to give is something that is a little bit external to public health, but a partnership with United Way and Dignity Health, which is our Mask On campaign. and you might see pictures of people with their masks on that say who they're masking for. So that was a big undertaking, and I'm so thankful for the partners who helped out with that.
That's a great campaign. It looks amazing, and I think it's really touches on heartfelt reasons for why people do wear their masks. So very,
Thank
very
you.
awesome program.
Thank you. We're still giving out masks and hand sanitizer. The Mask On campaign continues to work.
If people do want to take advantage of that, where can they go?
Well, they can contact me, or they can contact United Way, Dignity Health, but you contact the Mask On campaign directly, because there's just certain specific people from each of those three agencies that are working on this. But certainly you can go straight to Mask On.
Excellent, excellent. Okay, so what can you say about the spread of COVID-19 in our county? Are there any like hotspots or areas where you saw it, more of it happening, or how did that look from your perspective?
Yeah, thank you for that question. The spread is quite diverse, and so it's really hard to say that we've located any particular hotspots within the county more so than other areas. We do try to map out where our COVID cases are, but I would say that COVID is really everywhere, unfortunately. When we build our map, sometimes we might say, look, there's a hotspot here in this part of Stockton. And it's because a lot of cases track back to that zip code, but only to find that that was because we had a skilled nursing facility or a residential facility that had an outbreak there. And so it gets identified as a hotspot on the map, but in reality might not be a hotspot for the entire community in general. So it's a difficult thing to say where our hotspots are. Honestly, we find them everywhere, and COVID has been quite dispersed in our county.
Okay, and as far as that goes, the way that it has spread, I know that there's various ways that it can. And in our county, what is the majority of that? Is it community spread? What does that look like for us?
It is community spread for sure. And, the definition of community spread means it's just out there. It's out in the community, and we might not actually be able to track it back to a particular exposure. So a lot of people, when we call them and do our case disease investigation, don't have a clue where they picked up COVID, and yet they're positive. So that's really number one. But in addition to that, it's households, basically people getting it from someone else in the home. And it's work contacts, people picking it up at work. And it's a lot of people who are disclosing to us, admitting to us that they've been to a large gathering. So gatherings are still an issue. And now we're seeing transmission in our schools as well.
Wow, okay. And as far as schools, right now, can you speak to me a little bit about, are they all open? Are they doing some kind of halfway open, halfway not? Do you know what that's looking like? I'm curious.
Well, it's varied. We do have a lot of open schools and a lot that are planning to open. So there's many schools that in different phases. There's certainly some larger districts in our county that have not reopened to in-person instruction yet. So it just depends on the district you're talking about, the community you're talking about. Many of our private schools did ask for waivers and opened based on waivers back when we were still in the purple. And then when we were in red for 2 weeks, everyone else was able to open widely. So we do have a large number of schools that are open, but I can't tell you how many exactly.
Okay, it makes sense. So varying levels of open.
Very, very varied, yes.
Okay. And as far as gathering the COVID-19 data, who gathers that, and like who manages all of the number gathering?
So we have a wonderful team here at Public Health of epidemiologists, and they gather it all and put it into that the numbers that you'll see me talking about publicly. The whole process starts at the state with a process with a system called CalReady. And CalReady has been around for years. It's where we enter other things such as our tuberculosis and syphilis cases. It's a system for which we put in our positive cases, and the state will gather that information from labs and from healthcare, and then we use that system, CalReady, as well as a new system that was developed for COVID called CalConnect. And we then take the information out of there. And with that, our epidemiologists put together tables and graphs and all kinds of charts that are specific to our county.
Excellent. Okay. And if people do want to see the numbers, I know that there is a dashboard. Can you tell everyone what the dashboard is, where they can go to find it?
Right. So we have now a GIS dashboard, or a dashboard just in general, with a lot of information in there, and it's on our website. So it's on the San Joaquin County Public Health Services website at www.sjcphs.org. And you go and you click on the data information, and you'll see our dashboard pop up, and you can play with the dashboard and move your cursor around and see different types of numbers, from gender to ethnicity to cities and zip codes and death rates and all of that.
It's a very interesting tool. I've been using it since you guys first put it out. So very helpful in helping us to keep like a finger on the pulse in our community. Awesome. So I'd like to talk a little bit about common pieces of misinformation or misconceptions that you think are out there that you guys have had to battle in your department.
Well, there's misconceptions nationally about masking and about COVID being a hoax, and I'm always battling that and trying to explain to people that COVID is real and that our deaths are real. And some people think that the numbers we put out are not necessarily the truth, but it's the truth as truthful as we can get it, as from death certificates and from all the numbers we're obtaining. It might actually be an underestimate and not an overestimate. So that's one thing that happens, is that people tend to want to believe that they don't need to wear their masks or keep their distancing because they're not at risk. Another big misconception is that kids are not affected. There are just simply a lot of people who think that children don't get COVID, and that's just not the truth. We've had to date 2,240 children who are positive, who have been confirmed COVID, and my suspicion is that parents aren't taking kids to get tested as much as adults are going to get tested, so that might be an undercount. But that number represents always about 10% of our overall positivity. Our overall case count is always at about 9 to 10% represented by children 0 to 17. So they do get COVID, and we have had children requiring hospitalization. We have had children in pediatric ICUs with inflammatory syndrome. And so although you might not hear about it, it happens, and children can be at risk from this disease.
Wow. And thank you so much for addressing those two common misconceptions that are out there. I really appreciate you giving us the knowledge and information to combat those things. Is there any particular question you've been receiving in your office over the past few months that you're like, this is the most common question, we're always getting this question, how do you answer that?
Thank you, Courtney. And I do want to say, when I speak about children, it's not to scare people. Obviously, it's to inform people.
Definitely.
But I appreciate that you gave me the time to talk about that. When it comes to questions, I will tell you that we had, at the beginning of this pandemic, a phone line that blew up, and our phones went down because there were so many questions about some things that are as simple as, how do I wash my hands, and how do I stay away from people by 6 feet, and so many questions. Now, honestly, people kind of know what the rules are, and more so than questions, we just get a lot of complaints. Our phone bank is busy dealing with people who are calling in all the time, letting us know that they've been to a business, or they went to an activity where people were not wearing their masks, where people were not distancing, where there was live music or a band, and they want us to know that this happened and that we need to put a stop to it. So many complaints. People will tell us, I went to this shopping retail organization, and they were supposed to be open at 50% capacity, but it was full blown 100%. Nobody's doing anything, and they take photos and send them to us as well. So that is the majority of the types of phone calls we're getting these days.
Interesting. And when you get that information, is there anything that your department can really do or is that the right place that they should be sending that kind of information to?
Yeah, and thank you for that question, because we're happy to receive those complaints and try to route them for you. But honestly, the county has developed a complaint line and a way to complain online at the sjready.gov website. So that's really where we would want to direct people, is to go to sjready.gov. And there's a thing that you click on to enter your concern or your complaint. And that does get followed up upon. We do route that to the appropriate people. So we are trying to get on top of that. We don't take your complaints for granted. If you enter something, we do try to follow up, whether it be with the city or the law enforcement side of things.
Great. Thank you for that piece of
Mhm.
information. So when it comes to testing, who are you guys recommending actually receive testing? Like, who do you think should go to be tested? Do you have to have symptoms? What is your current recommendation on that?
Certainly, if you have any symptoms that could be COVID, we want you to get tested. That's for certain, without a doubt. But in addition to people who are symptomatic, anyone can go and get tested in our county. There are no restrictions. You don't even have to have an exposure history. So you don't have to say that you were near somebody with COVID. You could just say, I want to know if I might have COVID. And you don't have to have symptoms. You don't have to be a contact. And we actually do encourage people to do that, because we're trying to figure out what our true prevalence rate is. What is our true positivity rate? These are things that the state is using to determine whether we move forward in their 4-tier system or we move backward. And if only sick people get tested, that's what's going to show up, is that it's going to look like we have a ton of COVID. But really what we're trying to find out is how many people out of everyone has COVID. And those people who are asymptomatic, who think they might not have it, oftentimes do. And they are the ones who we think might be transmitting COVID, spreading it because they're not staying home, not realizing that they have it. So we do encourage testing. And there's many testing sites available throughout the county.
Thank you. For people to find that list of testing sites, is there a web page they should go to?
That would also be sjready.gov. And you would click on the COVID link and then click on the word that says get tested. And you will see that we have free testing sites in many of our cities. Our public health website also keeps that data up on our website.
Excellent. So when it comes to businesses, and as we're all trying to get back, opening up, getting people to come into our businesses, what should a business do if one of their employees does test positive for COVID-19? What kind of recommendations do you have for businesses who are in that situation?
Right. So this has happened over and over and over again, to the point where the state did come out with an employer handbook. So there's a lot of guidance in that employer handbook. And that handbook is available on the state's COVID-19 website, which is covid19.ca.gov. It's guidance for employers on how to handle people who say they're positive, people who say they've been contacts. In addition to that, here at San Joaquin County Public Health, we have created a business-specific email address, so that if you think you need some assistance, or you think you might be having an outbreak, or you just want to talk through a positive employee and get assistance, we're happy to help you. And that email address is businesses@sjcphs.org. We have a team of public health nurses that are manning that email address.
Oh, wow. Awesome. Thank you.
You're welcome.
So I know in the part of the summer, we had a lot of our ICUs operating above capacity for a period of time. And right now, some of our numbers are trending upwards. What has the pandemic brought to light about the county's ability to address these kind of public health emergencies? What have you guys learned?
So what I've learned personally is that our county's healthcare providers are a very dedicated group of frontline workers, and I commend them every day for the work they're doing. You might think that COVID died down and everything got better, but COVID has never completely gone away. All of our hospitals have had COVID patients in-house throughout this pandemic. They've never gone down to zero. We did drift downward and we were doing okay, but we're going back up again, and our hospitals are over capacity again, just as of last week. So we're just starting to surge, and it's um, concerning. And it's not just our county, it's statewide. You will hear the governor and others talk about how many counties are starting to go through a second wave. Um, so, I will say that our hospitals are ready. That's what I've learned. They've got the equipment, they've got the heart. We don't want to get them to the point where they're so overwhelmed that they can't keep up. But I will tell you that they do an awesome job. They do an excellent job.
Excellent. And I'm curious to dig a little deeper into that. But for those of us who aren't healthcare workers, and maybe we haven't been into the hospitals and seen what the workers are dealing with, what can you say about the toll that maybe it has taken on the healthcare workers? Are they kind of strained more than they would be without a pandemic?
Well, I'm sure that everyone who's viewing this session right now has COVID fatigue. So just imagine having normal COVID fatigue, and on top of that, having to wear PPE all day at work and seeing people with actual COVID who are sick. It's a drain. It's stressful. So they're experiencing COVID at work, and then they experience COVID in their personal lives, and it affects them 24/7. So I think, it's definitely for our healthcare workers. We really hope that they're practicing some self-care out there. Again, totally salute them for being our heroes. But I know that they're strained and they're tired, and they're working through this, and hopefully there's a light at the end of the tunnel for them.
Thank you for sharing that. I'm happy to know that we have a dedicated workforce for as far as healthcare goes. If there's any way that people can help the local community, is there anything they can do to help the hospital workers or to help just the community in general when it comes to COVID-19? Is there anything that we can do?
Well, honestly, what I think that healthcare workers would want you to do would be to follow all of our recommendations. I could say things like go donate PPE, get them some N95 masks. Of course, they would welcome that. But really what they want is for you not to end up in their hospital. So what I think they would appreciate you doing is talking to your friends, talking to your neighbors, spreading the word. Let people know that we're heading into a really difficult fall, winter right now. Get your flu shot and talk to people who don't want a mask. Be brave and see what you can do in the community to get people wrangled around this idea of protecting each other.
Excellent. Thank you. So apart from testing, what other COVID-19 resources could you recommend to people at this time?
So, resources for the general public, there are many. Basically, there's so many things you could read to stay informed, whether it be on our website or on the state's CDPH website. If you're talking about ways to find resources for your business, such as reimbursement or some financial assistance, that might come from your city. And so you might want to look at your city. Here in Stockton, we do have Stockton Strong. So there's a website that you can access to look at ways that you might be able to get help personally with your housing issue, your business issue. And there's even ways in which you could volunteer your time if you look at that. And so there's places to go on that website for elderly people who might need some assistance with meals. So I would encourage people to look at that.
Thank you. Thanks for sharing those resources. I just have a couple more questions for you before we go into our viewer questions. And so I do have a question about the outlook of COVID-19 in our county specifically for the next few months. Is there anything that you guys can say? What are you anticipating?
So as I said, we're moving up again. Our numbers are increasing. So I'm anticipating another surge. Whether you call it a wave or not is, it doesn't really matter. It's a matter of semantics, but you could call it another wave. We're definitely seeing an increase in our case rates, unfortunately. And that means that transmission is happening. So what I'm seeing is that as we move forward, as things open up, some people are letting their guard down and they think open means you're free to be completely open and do everything as you did before. And unfortunately, that's increasing our transmission rates. That's getting translated into an increased testing positivity rate and case rate, which we will see get posted today by the state when we get our tier assignments. That in turn gets translated into increased hospitalizations. And our hospitalization rates basically doubled in the last week. We had been
Wow.
plateaued with
Wow.
about high 20s to low 30s in our hospitals. So maybe 28 people, 32 people in the hospital at a time. And we had been there for quite some time. And that has doubled in just a week. So it's happening swiftly, more quickly than it happened back in the summer. The rise is happening more
Wow.
quickly. So a little bit scary. So what I would say is for the immediate future, in this next month, what I foresee is that we're going to have a rough time. And I'm really hoping and praying that those increased hospitalizations don't translate to a huge increase in deaths. Our hospitals are doing a great job with managing COVID. They've learned so much through this pandemic. They have really found ways to maybe not put a person on a ventilator or maybe treat a person in a way that will get them out of the hospital faster. So hopefully with all that knowledge, it doesn't translate into a large amount of deaths. I'm hoping also that as this new surge happens, we don't see it peak as high as we had seen it in the summer, but we need to get a control of it right now in order for that not to happen. And so whatever happens right now and in the next coming couple of weeks is crucial for how this peak is going to look. So that's the immediate future. I can't even tell you 6 months from now. That is so far down the line. We will see. I'm really hoping that a vaccine becomes available. I know it will be available. The issue is when and how much. So we need a lot of it, and we need a lot of people who are willing to take it. And that's going to be another issue in the coming, I think, 4 to 5 months, really, for the population at large.
Very, very interesting. So it seems then that we may be headed back to the purple tier. Is that kind of the direction you're seeing that we're probably going?
So, in order to head back to purple tier, we would need purple tier metrics for 2 weeks. That's the rule, is that you meet the metrics for purple for 2 weeks in a row. And last week, we just barely stayed in red. A case rate of over 7 puts you back into purple, and we were exactly at 7.0. So we stayed in the red. But I do foresee that our case rates are going up, and I would be surprised actually if we didn't revert to purple. That seems to be where we're headed. It's where our neighboring counties are already headed this week, and we're a bit behind them. So I just would be shocked if we weren't, but we will try our best to stop that from happening. We are going to do our best to try to keep our case rate down in the coming days, and that's going to matter a lot as far as what tier assignment we get next week.
Thank you. Is there anything else that you think is important for people to know about the COVID-19 pandemic or other health issues in our community?
Good question. There's so much I could tell people, and it's almost like I'm a broken record, and I feel like I keep saying wash your hands, wear your mask, stay home as much as possible, but those are really the key messages. Especially stay at home if you're sick. Please stop sending your kids to school if they're sick or they've been exposed. Please don't visit people in a county or a state that has a higher case rate than ours. We're seeing people come back and bring it back. So yeah, it's largely a broken record, but what I would say is that the twindemic is coming, flu and COVID. I have no idea how hard the flu is going to hit us this year. I'm really hoping it's going to be a mild season as far as flu goes, because that could really complicate things with COVID. But on top of that coming, the weather is changing. We want to get our businesses able to stay indoors. Let's please work hard to keep them indoors as much as we can. People don't really want to go to church outdoors or eat at a restaurant outdoors when it's so cold outside or it's raining. So we need to put this effort in for each other. Um, and please, if you're a young adult, I'm targeting you. We are following our case rates, and we are seeing that people 18 to 35 or so are those that are really driving our case rates up. And thank you to those young adults for getting tested. But what we're finding is that those of them who are getting tested are really having higher case rates than our older populations who are being maybe a little bit more careful. So I would beg our young adults to please take masking seriously and avoid the gatherings as much as possible. Try to keep it small and try to be careful.
Excellent. Thank you so much for that information and the plea to everyone to just abide by your recommendations. Thank you. So if people want to get in contact with you or your office, and maybe they have further questions beyond this webinar, how can they get in touch with your department?
We do have a website that you'll find on our, an email address that you'll find on our website, and it's PHS info. But if you go to our website, you will see that email address. And so we accept all kinds of inquiries from that and then route them to the appropriate department within public health.
Excellent. Well, thank you. Thank you, Dr. Park, for answering all of my questions. I really appreciate that. And at this time, we're going to go ahead and open it up to anyone watching to ask your questions. As a reminder, we have Dr. Park here as our guest, and we are discussing COVID-19 in our community. So it looks like we do have a few questions already. Okay, so this kind of touches on something that we talked about a little bit earlier, but I'm still going to ask it. We have a question from Jessica. County will have to go back to sheltering in place, or does it look like cases could be decreasing enough for us to move out of our current tier?
So thank you for that question, Jessica. And, I haven't used the term shelter in place for a long time because now we have this whole blueprint for a safer economy, the purple, red, orange, yellow. So even if we were to go back to purple, it's not a hard shelter in place order. You would still see nail salons and hair salons open in the purple. So you would have to kind of follow the rules as set by the state. And there are some things that remain open, like outdoor retail. And so it's not a hard shelter in place. Schools as well don't close if we revert to purple if they're already open. They don't close until they have a significant outbreak and we deem them needing to close. So it's not that we would really be shut down per se, but we would be reverting back to what we're allowed to do in purple.
Great, thank you. So I have another question, and it's asking about how can we encourage others to wear masks when maybe they don't think that they're necessary? I know your mask on campaign is one way.
Yeah, I think there's different ways to approach it. If you are talking to someone who just doesn't think that COVID is real, then you have to approach it from that point of view and, talk to the science, read about it. But if you are talking to someone who knows COVID is real but doesn't think it's their responsibility to wear it, you're really talking more to that person's heart and explaining to them that what they do is such a simple act. And if we were to all do it, we would see less deaths. And that death could include someone in their own family or even themselves.
Right.
So you're speaking to that person's ability to have, a moral compass and to say you're doing it for others. And then for those who really don't even want to put on a mask for other people, there is science that says putting on a mask protects yourself. So that's another angle as well. As I tell people, we're no longer just masking for each other. There's science now that says putting on a mask protects you as well from others who might have COVID. So do it for yourself. In the long run, it will help everyone, though.
So there's a couple of different angles you could try to come from to approach this. Awesome.
Certainly.
Okay, another question from Jessica. Are packages in the mail safe, or can they potentially spread COVID?
And there's a lot of research on how long can this virus live on certain surfaces. And early on in the pandemic, it was like, um, you know, 72 hours on steel, 48 hours on cardboard or whatever. I'm making up the numbers because I don't remember now. But there was research. And then since that initial research, there's been more research. Um, and I think there's a very, very slight risk of transmission from something like a package coming in the mail. And it's so small that even Dr. Fauci says that we don't need to worry anymore about it. So in general, I would say it's probably really not that important, and don't fret over things like packages. The concern is the respiratory droplet person to person is really where the transmission occurs. Having said that, I'm still personally wiping down all my groceries. I just can't seem to stop. Um, it's become habit and a way of life. And I feel like even if there's a minuscule chance of transmission, I'm going to delete it with Clorox and Lysol. So, and I think that's a little bit crazy and maybe overkill, but I am very careful. And so with boxes too, I'll wash my hands after I open a box, but I don't leave it outside for 3 days anymore as I used to. I'm starting to relax compared to where I was before.
It makes you feel safer, so why not do it? So another question from Jessica is getting tested for COVID painful?
I will be honest with you. A lot of people say that it's like you feel your brain is getting tickled. I've heard that phrase a lot. So there are different ways to get tested, and the original nasopharyngeal swab does do what it says. It's nasal pharyngeal. It has to go to your pharynx. So it goes up the nose and it has to make that turn back to your pharynx. That's still the most accurate, but studies have shown that if you do a mid-turbinate or an anterior nares, the specificity and sensitivity are also quite high. So I feel that they're accurate, and I do really try to tout the usefulness of those because we're still doing PCR testing on them. They're not the swift antigen testing. Your sample still has to go to a lab. It's still the real polymerase chain reaction testing. However, it's the swab that doesn't have to go all the way to the pharynx. The mid-turbinate has to maybe go all the way up to the point of discomfort, maybe a nasal bridge, and then anterior nares is even closer to the outside, and you just have a certain way of doing it where you just kind of press against the sides of your nostril. So sorry about this sunlight, but there are many testing facilities now that are doing the less invasive tests. So if you were to go to sjready.gov and see all of the testing sites, I will tell you that the ones at the Eastland Plaza and at Rite Aid here in Stockton, those are not the nasopharyngeal. They're less invasive, and it's self-collect. You put the swab in your own nose so you can measure your comfort and discomfort, and you run it on yourself so you have control. So again, the Eastland Plaza on Mondays is a Project Baseline. And also if you go to the Project Baseline website, the testing site at Rite Aid. In addition to that, if you see testing sites that are run by HR support pros, which there are many now in our county, those are mid-turbinate. It's not self-collect, they'll do it for you, but it's not the kind that goes so deep and still quite accurate. So for anyone who wants something more comfortable, that would be the way to go.
Okay. And you may have already defined this when you were talking about the type of testing, but I'm not too familiar with them. These tests, are they measuring only if you currently have COVID, or are they measuring for whether you've ever had COVID?
So the tests that I'm talking about, the ones that go in the nose, measure if you currently have COVID. And so that's at any of the testing sites that you will find on sjready.gov. Those are the ones that are measuring if you have COVID. The blood tests are antibody tests. That's when someone sticks a needle in your vein and draws blood. That will tell you if you might have had COVID in the past because there's some sign that you've built up some immunity to it.
Okay, great. Thank you. So I have a comment saying, this is from Johnny. He says, this information is so useful, and I'm so glad Talk to Downtown is doing this. I'm all ears now. So thank you, Johnny. I have a question. So I know we've heard about a vaccine. Can you tell us anything from your perspective that you know about the vaccine or that you like to share?
So we're not the only ones trying to make a vaccine. All these other sophisticated countries in the world are trying to make them. So you might hear a lot about a few certain vaccines, but it's global. The race is on. Here in the United States, there are a few companies that are standing out because they've made it to phase 3. So when you develop a vaccine, you have to do a phase 1, a phase 2, and a phase 3. And the ones that the state of California are really looking at are the ones by Moderna and Pfizer. And there's a lot of talk at the state level about the Pfizer vaccine because it's really seems to be on its way and might be the first one available. And as you know, some of you might know, it was big in the news yesterday that their effectiveness has been deemed at 90%, which is incredible. So their studies are showing that they're having really great effect. So the question is, when are they going to be available and how much? And we don't know. The state of California, at the California Department of Public Health, is waiting to figure this out and to find out from the federal government. In the meantime, since we don't know, everyone's just ramping up and getting ready. The state's putting together a COVID vaccine playbook. They meet with us, the county health officers, weekly to let us know what's going on and what the updates are. So we do hear about it often. We know that Pfizer requires ultra cold storage. So there's a lot of planning that goes into this because not everyone has these ultra cold freezers.
Oh,
And there's
wow.
a certain way that they're stored and boxed, and every vial treats 5 people. There's 195 vials in a box. A box looks like a pizza box. And there's 5 of those boxes in another big box that all comes packaged in, freezer sort of things, like the dry frozen material. So we need to plan on how we're going to disperse that. Initially, I believe the state is going to be targeting healthcare workers. And what the state has said is that in California alone, there are 2.3 million healthcare workers. So if they're first priority and get first dibs, and you need the vaccine 2 times, that takes up 4.6 million vaccines right off the bat. And are we even going to get 4.6 million from the feds to begin with? We just don't know, but we're planning. And here locally at San Joaquin County Public Health, we're planning. We are meeting regularly to see what's going to happen after the hospitals get their share. Then we might get some, and we will be dispersing to our push partners. And how are we going to manage that? So we're doing a lot of mass vaccination planning here on our end.
Very interesting to know. Like very, very just interesting to hear the numbers even. Oh, wow. Yeah. A lot of preparation going into that. Okay. I have a question about blood types. So this question says, I've heard that certain blood types may be immune to COVID. Is there any truth to that you can tell?
Oh gosh, that's a really good question, and I haven't followed up on that. I did read something about that a while back in the news, and I haven't actually taken the time to read further if there's been any more studies on that. It's certainly not being talked about amongst all the county health officers and with our discussions with the states or with the testing task force or with any of the other meetings that I have. So I would need to do some more research. I would say at this point, since I haven't heard about it, I would really doubt that that there's any degree validity. Of validity that we know of for sure right now. So I would say we should probably discount that until there's more information.
All right, thank you for that. So I have
maybe
another.
Wrong. We would have to read.
We need more research.
Yeah, and maybe I just haven't done enough research myself. So.
So someone has a question about Lodi Unified. They're asking. Basically, Lodi Unified is trying to reopen schools next week, and they're asking whether you recommend this.
This is such a difficult question, and I get this all the time, and I don't want to insert my personal opinion too much into it because some of it's related to the fact that I have kids of my own, and so I have to be very careful, and it's such a hard discussion to have. From a public health standpoint, the state has said when they think schools can open, and they did say that we could open at a certain case rate. So I allowed it to happen. I granted waivers, and some people got very mad at me that I did grant the waivers because they didn't want their child's school to open. But I'm looking at simply a list of 6 or 7 things that the state asked me to look at. Does the school have a plan? Does the district have contact tracing? Does the district have hand sanitizers? And there are certain things that I can say, yes, check mark, check mark, check mark, and you may open. But then can I say that there's zero risk to kids? No, of course not. And I'm even more concerned about our teachers because they're adults. And some of them
Right.
are older and have compromised immune systems or diabetes or other things that put them at risk. So some of it is a moral issue too. You know, is it okay for me to have my kids in school when I'm coming to work and I put myself at risk by coming to work? Then my kids might be asymptomatic transmitters to their teachers. And do I want them to be that person who gives it to their teacher? And that's a difficulty. I understand that on the other side of that is kids do well, which is true. They are by far going to do well, even if they get COVID. The likelihood is they'll have a mild course. And we've had no deaths here in our county of children from COVID, though
That's
we've
good.
had the MISC. So a very difficult conversation. And I can say that we'll never get the risk down to zero. So at what point do we say the risk is low enough? And the state put the numbers up for that. They put case rates up for that. I will tell you that if we were to go back to purple, any school that has not opened yet can't unless there's a waiver. And the waiver is only for TK through 6. So kids older than 6th grade, they wouldn't be able to go back if we go back to purple.
Oh,
And
wow.
yeah, and that's all because of case rate. It tells you that transmission's happening, so the risk is higher. So let's not open the schools. What I do tell our superintendents, and I communicate with them regularly, and I have a great relationship with them, and I really, they're in a hard spot, and I really appreciate all their work. I tell them from a public health standpoint, let's try to separate kids as much as we can. I know it's hard. Educationally, some people might want full classes, and it's easier that way to have 30 kids in one class with the teacher all at once, of course. It's not up to me what they decide, but if we could get those kids as far apart from each other as possible, the better. So that's my job, is to recommend and consult with them on how to do that at lunchtime, how to do that at recess time, how to do that in the classroom.
How to keep them separated. Thank you.
We got to try. Yeah.
Gonna try. Okay, another comment that's saying thank you for this very valuable information, and that's from Beverly. And I have just one last question, it looks like. This is from Michael. He asks, sorry, my lighting got really bright all of a sudden. I read that common mouthwash has been effective in killing the virus. Can you speak to this?
I can't. Honestly, I haven't read that yet. So all of you are doing more reading than me, perhaps. So I really can't, I haven't heard that one. Wouldn't that be wonderful if we could just, I would just constantly be swishing mouthwash all day long if that were true. And if it's true, I will do that. But I haven't heard that. And that's a very interesting study. You know, it does hurt me so much that people in my county have died from something that's so simple to clean off a table with some Lysol or Clorox. I think about that every day. And so if Lysol and Clorox can do that, mouthwash, maybe because there's alcohol, because we know alcohol and bleach kill it too. So very interesting. But how long does the effect last? Is it for 1 minute after you use the mouthwash, 2 minutes? That I would be concerned about knowing, is how long does the effect really last? But sad for me to know that hand sanitizer kills this thing, and yet once it's in your body, it wreaks havoc on you. And when I think about the people who have died from this disease, that really hurts me to know that something as simple as hand sanitizer kills it on our hands. And so we need to put that into perspective and keep washing.
Right. Well, thank you so much for that answer, and thank you so much for all of your other answers that you've had to this long list of questions. I really, really appreciate you taking the time out of your day I know you're busy in this pandemic. I really, really appreciate this, sharing this information with the community. So thank you again, Dr. Park, for being our guest today. That's the last question I have. Did you have something you wanted to add?
No, I just want to say you're welcome, and thank you for giving me this time. You know, anytime I have a chance to speak to the public, I appreciate having this forum. It's hard for me to get the message out, so I appreciate the time you've given me. Thank you.
Yes, it's very important and something I think people need to know. So I would like to just conclude by saying thank you, viewers, as well, for tuning in. This video is going to be uploaded to our YouTube channel, which is Downtown Stockton. And if you're already following us on Facebook, if you're watching this live, but we are also on Instagram, which is at Downtown Stockton, and Twitter at Downtown STKN. So with that, I would just like to say thank you again to the viewers, and thank you to Dr. Park, and have a great day downtown. Thank you, everybody.
Thank you, everyone. Goodbye.